then for the second presentation is from the Gajah University, Indonesia, Professor Soenarto Sastrowijoto, and we are welcome for his coming. And he has been coming to visit Taiwan for many times, and our good friends and various expertise in as a doctors and also as a medical bioethics, and also for the education. So we would like to introduce Professor Soenarto for the presentation of the topics as a teaching bioethics for transgeneration in the 21st century. Give a big hand to Professor.
Thank you. First of all, I would like to appreciate for inviting us. I am and my beloved Yati, my wife. In this opportunity, I would like to talk about teaching bioethics for transgenerations in the 21st century. It is the outline. Values and ethics has been as a discussion in this time, and ethics is also has been as a curriculum in various kinds of university in the world. For the 21st century, teaching bioethics in medicine is closely linked with very vast development of science and technology. We have to consider the effect of two different and conflicting processes. On the one side, scientific progress and having a new available modes of more effective therapies, surgical technologies, drug technology instruments, and so forth. There is an increasing awareness of the importance of health care as a fundamental right of all people. As a result, in many countries, life expectancy is more higher compared to previous one. On the other side, global health conditions are marked by inequities due to the poverty and lack of access to health services. So, if you are talking about the teaching, there are four reformations of higher education, not only medicine. The first one is informative curriculum. The second, formative, to be in the 21st century, transformative. So the output of this kind of objective and processes of education as an expert. And the second period of this 20th century as a professional. Here, ethics is really has been taught there, but it's a very minimum here, and then developing there. And also, innovation, small group discussion is started in this period. So we are professional. Most of that one is not enough in our living for the 21st century. So we have to develop our curriculum to transformative curriculum, and the additional subject of leadership and management is very, very important in this 21st century. And the output not only as a professional but also as an agent of change. And the new transformative curriculum, so the same, plus we have to have so many role modeling in this case. And the output not enough to be an agent of change, but it should be as a role model. The fundamental question is that how to teach ethics for the various generations, something you can see here, traditionalists, boomers, Xers, millennials, and even in post-millennials generation. Moral and ethic obligation of the university are not only to teach and train students, residents, but also the staff, lecturers, to be an expert, but to be not an expert, but also to be a professional, agent of change, and even role model. This is, we have the ancient generation, the cosmic generation, and follow that here, the 20 generations and 21st generation. So the post-millennial who born in the 21st century. This is one of the attitude, the difference of attitude toward ethical issues related to this generation group, traditionalists, boomers, Gen Z, millennial, and post-millennial. There was something like this one, and traditionalists may be included me in this case. Resist change, and for boomers, self-centered sense of entitlement, workaholic and motivated, do not appreciate feedback. And this generation, lazy in this case. And in this millennial, lack of basic literacy fundamental, very short attention span. And for this one, perfect in English and communication nationally and worldwide, eager to continue their study in postgraduate, integrate technology into a place with their good, bad, or ugly attitude. That is the difference between them. So, if we would like to have to know the misconduct of the millennials, for example, you can see here various kind of issues. Personal business company time, lying to employees, uses behavior, company sources views, discrimination. This is the number of percentage. Millennial who observe unethical behavior, this is very, very high. Is that true or not? It should be studied. Millennials consider a certain behavior in the workplace, for example, in this case, uploading personal photos on a company network, working less than compensate cut and benefit to pay. This is some kinds of issues that we have to learn. Is it right or not? Higher education and University of Gajah Mada, Universitas Gajah Mada, we have what we call health approach in teaching bioethics. Health in the meaning that human experience and human thought and culture as the humanities that should be discussed in these courses. Implementation of basic principle of bioethics or ethics here is key here. And following the legal regulation now and pay demonstrating competence our specific field of work and study research as a professional, or in this case, professionalism. This is what Universitas Gajah Mada have approached that we have now as a routine courses. Here, we can a little bit talking about humanities, ethics, legal, and professionalism related to this idea. Even ethics, for example. From ethics developed to biomedical ethics, the principles also developed that, to bioethics, to global bioethics, that based on capital investment and social investment here. And then Gajah Mada developed what we call a new sense of bioethics to balance this one. Business is very important, but social is also very important. So that's why this is the new sense of bioethics. And also, belief in God and faith is very important. Instead of respect for others, God creation, not only between man and man, human and human, but also human with animals and also human with environment, for example. So we are teaching bioethics is health approach, the meaning that professional of an institution such as school or medicine in this case, even the other education, in engineering, agriculture, etc., all will be based on the professionalism of each individual person in the institution, faculties, teachers, administrative staff, students, and residents, since professionalism moves from individual person to institution. And professionalism of the institution should be moved also, increase, not to be professional, but also each institution should make a change. Because also as an agent of change. Here, that bioethics is very important in higher education from undergraduate, master program, doctorate program, even in continuing professional development should be taught there. From the first year in undergraduate, continue to CPD. There is a very complex processes of medical or higher education. How about the input? Input not only the student but also our faculties and also administrators. The quality of them, it should be there. Also the process, the teaching and learning process. The quality of graduates, the quality of outcome, the quality of impact should be discuss with all of people related to this program. It is from Pasha et al. 2010. The systematic review on in medical education, curriculum design, student selection, teaching learning method, role modeling, assessment method, etc. is also should be considered.
Thank you very much for
Curriculum design, for example, in this case,
thank you.
must be carefully planned, appropriate with the mission of the institution, and issues should be learned and considered as the intended related to the training program, expected student learning outcome, etc., up to the assessment and also the communication, educational informant, and the management of the curriculum is very important in this case. Student selection, for example. The student qualification should be developed based on the clear criteria appropriate to the institutional mission, using the international and national standard to develop an institutional standard in this case. Teaching learning method is also various issues that should be learned. And the final goal of this higher education method is to develop knowledgeable, skillful, humane, medical doctors or engineers who have a new transdisciplinary tolerance, transformative attitude, the new transdisciplinary transformative attitude. Role modeling. Are we as a role modeling in our family, for example? Are we as a role modeling in our class, as a teacher? It should be also be discussed with the student. So the student could find their role model from variety of their teachers, because not easy to have a role model in scientific knowledge and attitude in one person. Maybe we can take these three concepts from various persons. Also, students have the opportunity to have a views in this case. What is the view from the student side? Various assessment methods could be used, but no single method fit to various kind of issues. Some student views on health professional for the 21st century related to the teaching professionalism. We have 5 points. Student agree of knowledge, skill, and attitude to be achieved by all doctors on graduation day. The necessity of involving students within the entire process from developing curriculum and in evaluation system program. Students from low-income countries have the benefit for such of initiative. Interprofessional forum should be bring together medicine, nursing, pharmacy, and allied professionals in a transdisciplinary approach, field of studies approach. Because if we are talking about this one, why trans, I have this one, no, this one. This is what we call it monodiscipline, that is multi-discipline. Even among discipline have no contact, but close each other, not individual discipline. And move to multi-discipline, interaction between this one, this is a wrong figure, interaction between this happen, and this one, what we call it, mono, multi, inter, and then what we would like to have is the trans-discipline. 3 disciplines should be as a trans communication, not only inter communication. So based on the above 5 generations, the characteristic is good, bad, and ugly, with their positive and negative character. Teaching bioethics is similar among generations. Teaching bioethics for those 5 generations should be conducted in trans-generation approach among traditionalists, boomers, Gen-Zers, millennials, and post-millennials. And the goal of this approach is to have a new tolerance of trans-generation attitude among us. I don't know in this room how many generations we have there in this room. Many, I think. And maybe I'm the old one, the oldest one. And the other one is that the question of who should teach bioethics in medical education or any other education, bioethicists, philosophers, or medical doctor, physician, or practitioner who learn the bioethics, who teach them. In responding to the above question, Faculty of Medicine, Center for Bioethics and Medical Humanities in Gajah Mada conducted an international meeting, and that time started in 2000, an international exchange. And after this successful meeting, Indonesian participants developed what we call networking in Indonesia and Center for Bioethics and Medical Humanities in Gajah Mada University. This one, Center for Bioethics and Medical Humanities held what we have said. The first group from 2010 to 2012. The second, this one. The third, this one. And currently, we are starting with the courses, what we call it, graduate certificate courses, not degree program, but graduate certificate program. In this first, the participant is not a young man. So many professors at the time. What is really bioethics? That is the question. And not easy to answer the question of the professors, right? And Gajah Mada also developed what we call it White Book of Bioethics, 2014. And this year, we developed the postgraduate program for bioethics. And then, between UNESCO and UGM conducted ethics teachers training course the last month. Ethics UGM UNESCO will be conducted in yearly. So this is the suggestion of the UNESCO. And then we also try to develop a textbook on teaching bioethics for the 21st century. I hope could be published in 2019, next year. And Gajah Mada proposed OGM UNESCO chair for ASEAN Pacific in this year. That is a suggestion from the UNESCO, not only our ambition, but the suggestion from the UNESCO. The importance of implementation of ethics in the formation of medical higher education, especially for the 21st century, to have an agent of change and role models. Up until now, the question to who the teacher bioethics of medical student is that bioethicist, philosopher of that, is this still a question? But we have also the responses during these health issues and the postgraduate program in bioethics. The big question from this one, if you are as a PhD in bioethics, so what is your work now? Teaching? Practice? It's also another question that we have to discuss. We are, as a teacher in this case, we have to apply the 10 principles of higher or university teaching: content competence, pedagogical competence, valid assessment, respect for institution, respect for transcultural background, dealing with a sensitive topic. Student development should be observed, dual relationship with the student, confidentiality, respect for colleges should be there. It's not easy to be as a teacher. In responding to the above question, Faculty of Medicine, Public Health and Nursing, Center for Bioethics and Medical Humanities carried out Gajah Mada and Harvard Medical School in this year, what we have said. After the successful meeting, Indonesian participants developed GPKI networking and also developed a Center for Bioethics. And someone who have complemented with the courses of this post-exam received the graduate certificate. We believe that he or she is competent in teaching bioethics for undergraduate. School of Medicine UGM developed also IRB and then graduate certificate. That is, we have discussed before, postgraduate program, and UNESCO and UGM carried out international ethics teachers. We have discussed it, and master degree program we are just this year we started. This is our member in collaboration with Harvard. 14 faculties we sent there. Fulbright is also there. And I remember that we have some in this 2013, the Asia Pacific Bioethics Education Consortium developed there. I think it's also stimulated with the Education Consortium, Erasmus Mundo, in European Bioethics Education Consortium, similar with that in the Europe and the Asia. I think it will be discussed in this conference, and we can develop that to activize this consortium. That is my suggestion for a moment. It is also a good opportunity for us that we have what we call it the Medical Education Act number sekian 2013 in Indonesia. All medical schools in Indonesia have to teach and train their students in basic medical sciences, clinical sciences, bioethics and health humanities, community medicine and public health, and also medical education. This is a very good opportunity for us in also supporting this act to Indonesia. In summary, all of us, all of the generation, we have a good, bad, and ugly character. I believe that. And the teaching and training bioethics for all generations basically should be no different. But there are attitude differences toward the ethical issues. For this issue, different attitude, background should be treated differently. To all to be tolerant on transgeneration attitude. How to get bioethics for them? The answer will be various, such as training, courses, self-directed learning, role modeling, etc. on this side. If there is a serious violation, should be punished appropriately. That is what I can do for this conference. What is really teaching bioethics for transgeneration in the 21st century. Thank you very much for your attention. God bless us.
For the discussion and the feedback and the comments. Thank you for your attention. Please. And if you would like to raise your hand and to present your
Okay, I am Dr. Shakur from Bangladesh. My question is for the first presenter. I have been learned many things from your presentation, and first of all, I like to thank you for your brilliant presentation. But I also related to neuro rehabilitation, so I have a small question to you. What may be the ethical dilemma or ethical issues when you involve a person with a stroke? What may be the ethical dilemma or ethical issues when you involve a patient with a stroke in a research? You can understand? What will be the ethics, neuroethics, when you include a patient having a stroke, that is an unconscious person, in a research in neuro rehab or neuroethics? I don't. It's a very small question. What will be the ethics? Whether I can explore it. If the patient is unconscious, he could not give any informed consent. So this is on kind of ethical issues to include this person in your research work. So many ethical issues and dilemma over there. So I have the query, what are the ethical issues when you involve a person that may be an unconscious person with a stroke? It's a very simple question. Thank you.
Please, Professor, would you like to say feedback on the question?
Yes, I finally got you. The Dr. Suction also, like Dr. Fins, has a emphasis on the human rights of the unconsciousness person. Yeah. And he reported that the 41% of the vegetative state patient is minimal state consciousness state. So, as you know it, the rights of the vegetative state patients is very vulnerable to enduring, to give some consent and to give him life support system. So probably in the Asian countries, the consent are given by the family members or the guardians, but I think the individual patient has not much right on the informed consent rather than the members of the families. So that will be a problem because the patients in unconsciousness state cannot give correct information, no informed consent before the enduring his life or give a life support system. So it's sorry. I think it's one of the human rights that Dr. Fins stressed. Sorry, not for sufficient. Yes.
So, anyone would like to give back? Please.
Hello. Yes, I would like to question or just give you a comment back of John about burning the bridges between neuroethics and bioethics. In India also, there are more old people who are becoming dementia. They are suffering from dementia, and children are suffering from dyslexia and ADHD. There are so many. I would like UNESCO or Korea and your help to inform the medical university as well as in Tamil Nadu, Madras University, where they have neuroscience, MSc neuroscience, to advise them to bring about neuroethics and bioethics together so that that will improve the population. And as far as Sir Soenarto, Gajah Mada University, I would again request UNESCO or even Indonesia to advise the medical universities as well as the Madras University and other state universities and central universities in India to bring about what you call teach bioethics for Transgenerations, as well as introduce bioethics committee in the medical universities. I would like you to advise. That's all.
Thank you for your comment. Yeah. As you suggest, the science and the neuroethics should go together. So in Korea, we are going to plan to include the neuroethics curriculum in medical university. And second, we have a neuroethics. We are going to have a neuroethics information center, which fill the gap between the neuroscientist and the neuroethicist, and the neuroethicist and the general public. And we are going to write a book for the beginners, for the public. And most of all, we are going to initiate the National Neuroethics Committee by law. So we are preparing the legislation for that. Thank you.
Please, yes.
Thank you very much. Yeah, maybe I use the other. You can hear me okay? Thank you. Yes, my name is Sastrowijoto. Thank you very much for the...
Thank you for the excellent presentations. I'd like to ask a question on the ethics of neurological modification through education to become better people, which is a theme to link both of your presentations. In education, we are engineering people, engineering their morality and their social characters. As Professor Soenarto mentioned, there are different characters, and often older generations criticize younger generations. This has gone on for millennia. We can see it in ancient writings from there. Are there distinct characters or not? We can certainly see personality traits divided between characters, and how do we respond to those different personalities through tailoring ethics? And do we want, for example, to make individualists into communitarians, and communitarians to express their own identity in making better decisions and informed decisions? So finding this balance between different personality traits is a mandate of education. At the same time, this then presents us a question of, it is a neurological intervention. It's called education. It's been going on for a long time. So we're social engineering. So how do we, what are the criteria for this, to Professor Van Jun? How do we provide limits? Should we engineer people to become better? And then we have different traits that were presented in the lecture. Is bioethics the art of decision making better decisions, more informed choices for ourselves? Or is it the art of becoming better, more loving individuals and communities? And maybe it's both. And for those who are interested, the discussions of neuroethics we had since ABC 5, most Asian Bioethics conferences have some session or talk on neuroethics, and you can find some of these on YouTube on the channel. But we're still left with these persistent questions, I think, and so it was a good, very excellent start to the conference. Some questions for both of you. Thank you.
Thank you, Dr. Leo. Your question is really very complicated. It's not easy to be answered. But I think if we would like to educate to our people, really not only the young people, but also the middle or the old people. But maybe the way in teaching or the way I like to, even to the student, not I teach them, let us discuss together. This is the issues. I think the same is between the orders. Discussion, good communication is one of the way in educate indirectly to others. That is my short answer. Do you agree with that? If you don't agree, let us afterward we can discuss again.
Of course, I agree with you. You're my teacher. Thank you.
We are living in a very competitive environment, especially in Asian countries, for education, job, and promotion, and there is a large tendency to increase the intelligence through the neurostimulation or neuroenhancement. But most I worry is the recent transcranial direct current stimulation, which is performed by some to produce on the skulls and give them small amount of direct current. So it's not, it is non-invasive. Yet the companies are trying to give the direct to consumer experiences on the school children to increase their intelligence or to increase their school record. So I think it is a heavy problem that we must deal with. I think in these days I read on newspaper articles that the TDS, transcranial direct current stimulation, gives some increase of the memories of young people, but I think that we cannot change the we should not change the identity of the people, especially the narrative identity of the people. So I think that is the bottom limit of the neuroenhancement.
Yes, please, the gentleman. Yes.
Hi, good afternoon. I'm Sean from the University of Tasmania. A lot of the discussions in neuroethics, for instance, and also in bioethics, have focused a lot on Western perspectives. Even if you survey the literature, there is so much discussion that are purported by neuroethicists in Canada and Australia. in the US, and a lot of these discussions follow bioethical principles that are based on a lot of Western principles like principalism and utilitarianism. So I'm just wondering, also for both panelists, what do Asian philosophies from Confucianism, from Taoism, especially on the philosophy of mind, or in bioethics, how do they play a role in shaping policies and in shaping regulations for a lot of projects, especially like, for instance, in the Korean Brain Initiative, in the Japanese Brain Initiative, and in the Chinese Brain Initiative? Should we just actually apply the frameworks that are being used by the Human Brain Project or by the Australian Brain Project in our regulations and policies regarding confidentiality, privacy, or what research should we prioritize or not? Thank you.
Thank you. So, anyone would like to feedback? Yes.
I'm sorry. Maybe I can see. I myself, not a philosopher, might be. I myself as an applied. I'm not a bioethicist. I'm applied bioethicist. So, in daily life, I apply bioethics in many activities. So that is maybe one way that we can do, rather than teaching, and discussing, but we follow. Let's say if we communicate with students, we communicate with the faculty members, we communicate with the people, lay people, even the lay people, we can use the simple way, simple terminology, not too high, not too philosophical terminology, but we can use a simple terminology that could be adopted by our friends or our student or our component, and in this case, in discussion. That is my answer in this case. Hopefully can we answer your... Is that question or is that...
I think more of my question is like, where do Asian philosophies or Asian principles such as Confucianism or Buddhism actually play a role in shaping bioethics education and practice in Asian countries?
Yeah, sometimes in medicine, we use the cases. That is applied one. Because let's say if we are facing with terminally ill, for example, in this case, there's so many dilemmas, ethical dilemmas, so many ethical dilemmas. So that's why that is what we can do, what we can do for the people. It's not easy really.
So may I take an advantage as a chair? I would like to say a few words. In old Chinese way of education, to educate is not only to give the knowledge to the receiver, but also to educate a person as a good, how to be a person. And the final goal is to how to be a good person. This is the old Chinese Confucius way to teach. So if I implicate this scenario into a current situation, we can say our ethical is not only based on personal. In Asian culture, we are also linked with the social components. And the final is about the legal components. As the cases mentioned about the comatose case, unconscious case, so he is not responsible. He can't take his own responsibility. But what's the role of the social component in deciding the scenario of this comatose case? And also the legal components. For example, the social components, we have a lot of the identifiable guidance to support the decision making.
Yeah, even though the cases is unconsciousness. And also the legal component is back up, support the decision from the social components. For example, our legal component is that if you can identify the legal representative, maybe the spouse, maybe the children, they can make a decision. And even though it is not due to the person autonomy, but due to the social network, we can make a decision for this. So I think that is the importance as an ABC. We would like to identify the Asian culture, how to implicate into the situation of this bioethical issue. Yes, yeah, this is my yes. Professor Yan.
Yeah. Thank you very much. It's really a very good comment on it. And I think, yes, you have already answered it partially, but can I just answer in one sentence that how we, in these opportunities, Asian Bioethics Conference, explore our local wisdom for global solutions. Because by having those, we can share that. I believe that each of us has a local wisdom that could be shared. And of course, it must be very suitable to be implemented in their individual cultures, religions, etc. Do I make a comment of yours? Thank you very much. This is very important.
Close to the end section.
Thank you. Thank you, and it's good to have you ask the question because it relates to the origins of the Asian Bioethics Association. So, in 1995, when we founded the association, it was a rejection of the concept of colonization from Western bioethics and Western systems of epistemology of knowledge onto other countries to say you should follow principalism or you should follow certain systems of knowledge. So if you look in the proceedings of the previous 19 conferences in the Asian Bioethics Journal, many other journals which you can find outside, you'll find several thousand papers published on the topic from Asian scholars. But it's a perpetual question. What is distinctly Asian or African or indigenous or whatever about each Indonesian, Malaysian, what it is. I think one of the principles that I'm finding more and more is that some things unite. For example, karmic systems. We can find the imposition of legal systems that you should pay for your mistakes or you should have responsibility. That's rather common. And that can be argued from Western principalism or from Eastern karmic systems of knowledge. Both can be applied. And we've looked at many of the principles, many of the scholars in this room have written about it. So I invite you, please also write yourself about how you think in your education to date local knowledge was applied to help shape your responses. That you can find responses, and please actively ask transgenerational questions to the people of different generations here and different backgrounds, and maybe together we can find an answer to your question.
If I can come into this. I want to, I'm Professor Dr. Taslima Mansoor, the Dean of Law of Dhaka University. I wanted to share, my experience as a legal expert, not as, I'm also the President of Bangladesh Bioethics Society. It is really values, not only knowledge and skills, but also values, which is very much important. And values that keeps us to be a good human being. So these values can be international, these values can be local, but the values is the main thing. It can be religious. So I think we also in International Institution of Law Schools, we came back and to find out the outcome of legal education. We found that the main thing is not only knowledge and skills, but also values, which is very much important. Justice, equity, good conscience. So this is the things also I think the 19th Asian Bioethics Conference will highlight. Thank you.
Thank you for your comments. So thank you for all the speakers, 2 million speakers about these 2 important topics, and also all the audience for the comments and the questions. Thank you. So we have the half an hour's coffee break. So please come back and